is Joelis Pacheco, and this is my medication administration skills checkoff video for NU 311. Here is my badge. Now I'm going to do a room scan. So this is my setup. Today we are in my kitchen slash dining area. Okay. So for this procedure, I would be following the no interruption zone policy. So I would keep conversations with colleagues to only essential topics. All doors would be closed, and then I would not be taking any phone calls to ensure that I'm not interrupted during this procedure. So I'm going to begin by comparing my order sheet to my MAR. So I'm going to start off with my patient. So Jaguar J. Jones we have here today. Jaguar J. Jones I have on my MAR 8/25/1963, 8/25/1963, 4176352, 4176352. He is allergic to penicillin. He is allergic to penicillin. Today I'm going to be giving him morphine sulfate. I see on my order morphine sulfate. On my MAR, morphine sulfate, 5 milligrams, 5 milligrams. I am, every 4 hours, as needed for pain, as needed for pain. So since my order and my MAR match, I have all of the components for a legal prescription. So I'm going to put my order sheet to the side and then use my MAR. So I'm going to perform hand hygiene, and I'm going to begin my first check of the 7 rights for accuracy. So I'm going to start off with right patient. So Jaguar J. Jones, 8/25/1963, MR 4176352, allergic to penicillin. Okay, so next I'm going to do right medication. So he is to receive morphine sulfate today. So from my medications right here, I'm going to pick out morphine sulfate. So this is morphine sulfate. It expires 12/20/2025. Morphine sulfate. And then there's that expiration date. So this medication is not expired. So he's to receive 5 milligrams of this medication. So this is a 10 milligram per milliliter vial. So I would need to convert from milligrams to milliliters. Excuse me. So I would convert from milligrams to milliliters, and I would get 0.5 milliliters, which I wrote here on my MAR so I wouldn't forget. Since morphine is a high-risk drug, I would get this calculation checked with another nurse, and I would also redo the calculation to ensure that I have the correct number. So again, he has 5 milligrams. This is 10 milligram per milliliter vial. So I needed to convert from milligrams to milliliters, and I got 0.5 milliliters. So next, he is to receive this medication, IM. So for an IM injection, we would need a 3 milliliter Luralox syringe, a blunt plastic cannula, and a 23 by 1 inch precision needle. So now I'm going to draw my medication for correct dose. So I'm going to clean my vial, an alcohol pad. I'm going to open up my Luralox syringe. And I'm going to open up my blunt cannula. Screw this on here. So he is to receive 5 milligrams, so I calculated 0.5 milliliters. So I'm going to draw 0.5 milliliters of air. Okay. So now I'm going to put this right here, and then I'm going to push that air into my vial, and I'm gonna drop again 0.5 milliliters. I want to make sure I don't have any air bubbles. And I'm going to scoop this. Okay. So here I have drawn up 0.5 or half a milliliter. Okay, so this is an IM syringe, so I'm going to get rid of this step and dispose of it in my sharps container. Now I'm going to switch it up from my 23 by 1 inch precision needle. So I'm just gonna leave this right here. So next he's going to need this every 4 hours. So I'm looking at the time and he has not received this medication. This is as needed for pain. Mr. Jones has stated that he is in pain for right indication. And so now that I've gone through that, I have all of the components for a legal prescription. So that concludes my first check of accuracy for the second rates. So now I'm going to begin my second check for the 7 rates of accuracy. So I have Jaguar J. Jones, 8/25/1963, 4176352. He is to receive morphine sulfate. So here in my vial, I have morphine sulfate, and then here in my syringe, I drew up morphine sulfate. He is to receive 5 milligrams of this medication. So I have a 10 milligram per milliliter vial of morphine sulfate, and then here I drew up half of a milliliter of morphine sulfate, and I had to convert from milligrams to milliliters, and I got 0.5 milliliters. Again, I would redo this calculation to ensure that I got the correct dosage, and then I would also get this calculation verified with another nurse, since morphine is a high-risk drug. So he is to receive this medication IM. So for an IM injection, a 3 milliliter Luralox syringe is a good syringe for this injection, and a 23 by 1 inch needle is a good needle for an intramuscular injection. He is to receive this every 4 hours. So I'm looking at the time and he's not received this medication. This is as needed for pain. He has stated he is in pain for right indication. And so I have all of the legal components, or I have all of the components for a legal prescription. So next, I'm going to draw up a label for my vial. So I'm gonna get, so on this label, I'm going to write Jaguar J. Jones. I'm getting this information straight from my Moore. So Jaguar J. Jones. I'm also going to write the drug, which is morphine sulfate. And then I'm also going to write the dose that he is getting, which is 5 milligrams. So I had to draw 0.5 milliliters into my vial, since I had to convert from milligrams to milliliters. So I'm going to write 5 milligrams per 0.5 milliliters. So I'm going to take this on my syringe. Here is my label with patient name, name of drug, and dosage that he is getting. So that concludes my second check for the accuracy for the 7 rates. So now I'm going to go to my patient's room I'm gonna bring my more, I'm gonna bring my vial, and I'm going to bring my syringe. And I'm gonna move this to the side. So, move this over. Okay. Hello, Mr. Jones. My name is Joel Pacheco, and I am a student nurse here at the University of South Alabama. Today, I am going to be giving you some morphine sulfate, but before I do that, I need to just verify some information. So, I'm going to perform hand hygiene. I'm going to raise Mr. Jones's bed to a proper working height, and I'm going to lower the side rail. So, I'm going to now begin my third check for the 7 rights of accuracy. And here are his little armbands. So I have here Jaguar J. Jones, 8/25/1963, 8/25/1963, 4176352, 4176352, allergic to penicillin, allergic to penicillin. Mr. Jones, do you have any other allergies that I need to be aware of? No? Okay. So at this point, I would perform some pre-assessments. So I would check for respiratory, Mr. Jones's respiratory rate. And then I would also check his pain scale. And I would check respiratory since morphine is an opioid, which can cause respiratory distress. So now that I've done my pre-assessments, I am going to continue with my checks. So I have morphine sulfate on my MAR. I have here a vial of morphine sulfate. And then on my syringe, I also have morphine sulfate. And then it also says Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones on my syringe. He is to receive 5 milligrams. So here I have a 10 milligram per milliliter vial. And on my syringe, I have 5 milligrams per half a milliliter. And then in my syringe, I drew up half of a milliliter. He is to receive this, and then I had to convert from milligrams to milliliters. So I got 0.5 milliliters, which I have here in my syringe. He is to receive this medication intramuscularly. So for an intramuscular injection, I have a 3 milliliter Luerlock syringe, and then I also have a 23 by 1 inch precision needle, which are both good for IM injections. He is to receive this every 4 hours, so I'm looking at the time, and he has not received this medication. And then this is as needed for pain. Oh, I'm hurting. So he has stated that he is in pain. So I have all of the components for a legal prescription. So that concludes my third check for the 7 rights of accuracy for the 7 rights. So I'm going to wash my hands once more, and I'm going to don my gloves. And I'm gonna put on my goggles. So since I'm going to be giving this medication intramuscularly, I'm going to be having Mr. Jones come to his side to do the ventrogluteal intramuscular injection. We also have the options of the deltoid or the vastus lateralis, which is both subcutaneous and an intramuscular, but today, since ventrogluteal is the most preferred intramuscular injection site due to the lack of innervation, I'm going to be performing that with Mr. Jones. So he's laying on his side, and I would, since he's facing me, I would use my left hand and I would palm at the greater trochanter. I would ask Mr. Jones to move his leg up and down just so that I can verify that I can feel the greater trochanter. My thumb would be facing the pubis or the groin. My index finger would be on the anterior superior iliac spine, and the rest of my fingers would be laying on the iliac crest to be making kind of this sort of V shape. Here at this section where it's kind of awkward, but right here I would be palpating for good muscle, and then I would also do check for skin integrity. So if there was any signs of bruising, or if I felt any tenderness, or if he reported pain in this area, I would not. I would select a different location and a different intramuscular injection site if he were to be telling me those things. So I'm palpating for good muscle, and so I would not give the injection with this hand position. Rather, I would get an alcohol swab, and I would clean the area in a circular motion. I'm making sure you can see that. There you go. And then I would take the alcohol wipe and place it right there, just so that I know where I want to go. Now I'm going to remove my needle cap from my sharps container. Okay, Mr. Jones, you're gonna feel a stick in 3. And when I say 1, you're gonna feel a stick, so I'm going to spread his skin. And now I'm going to 3, 2, 1. So I'm going to aspirate to check for any blood, and I don't see any blood, so I'm going to inject that slowly. I'm going to put my needle in my sharps container. I'm going to apply pressure so that Mr. Jones doesn't bleed. You did very well, Mr. Jones. So now that all of my sharps are disposed of, I'm going to put Mr. Jones back to a comfortable position. I'm going to move the side rail up and then lower the head of lower the bed to the lowest possible position. Going to be removing my gloves and disposing of those. I'm going to perform hand hygiene. So, Mr. Jones, I'm going to sit here for a couple minutes just to make sure you don't have an immediate allergic reaction to the morphine that I just gave you, which you did not. Okay, Mr. Jones, so now I'm going to be going to the nursing station. I'm going to document the procedure, the medication that I gave you, and how well you tolerated the procedure, and I'm going to come back in around 15 to 30 minutes to make sure that you don't have an allergic reaction to the morphine that I just gave you. So, and then I would also be coming back in 15 to 30 minutes to see if your pain has diminished, whether your pain has gone down or not. So, I'm going to take this, I'm going to go document, and then I'm going to come back to see you in 15 to 30 minutes to see if you have an allergic reaction. And that concludes my skills checkoff.